Welcome back to CTV Morning Live. It is time for our Ask the Expert segment with Ottawa Physiotherapy. You can send us your calls. You can call us 789-6559 extension 2803. You can always send us a message via email, via Twitter, and you can email us in ottawa.morning@ctv.ca to ask us your questions. Interesting topic today, and we are talking about headaches. It goes a little bit beyond just maybe asking for a head massage or taking some medication. Joining us to talk about this from Ottawa Physiotherapy and their sports clinics, Matthew Pollicall and Peter Wade. Great to have you boys back on the show. And so we are talking about a topic, I think, that a lot of us deal with, probably more so than we would like, and it's something that you see quite often in the office.
Right. In many ways, what happens is when we're treating clients, we're usually working on their neck, and they, as a byproduct of that, their headaches disappear. And they're kind of surprised that physiotherapy can actually help with headaches. So one of the things that a lot of people don't really realize is the neck, in many ways, as it's joined to the base of the skull here, there's the first top three joints of your neck. And these three joints are very important in many ways, and it's also the primary causes of headaches for a lot of people. So as we're working on the neck, we directly or indirectly loosen up this area and the headaches disappear. So the common complaint that people talk about when it comes to headaches is the pain starts at the base of the skull, and it sort of wraps all the way around on the top, and it almost feels like they're getting ice picks going through their eye. And that's usually called a tension type headache. And if we can resolve the muscles or the joints that are dysfunctional, in many ways we help with the headaches. So there's a picture that I get that you might have up, figure 1. There you go. So those are the 4 key muscles at the base of the skull. Now it looks really big, but you got to understand that in regards to the neck, for all of us, it's just this little space here. So you're talking about muscles no more than the length of your finger, which is right at the base of the skull. So that's where a lot of headaches come from, and as a result, if we treat this area, we're going to be helping with headaches.
Do you find a lot of the patients coming in have been dealing with this for years on end, that they've had these endless headaches and they're just at the point where they need relief from this?
Yes. A lot of people think that headaches are acceptable, and they've accepted that basically. I mean, it's just a day-to-day thing, but it doesn't have to be that way. And so if we can just deal with whatever is wrong, you'll be surprised at how the headaches go away, and in many ways, your neck pain or your upper back pain as well.
Peter, you're dealing hands-on with these clients. Can you tell once they start to see the relief how everything almost changes? Mood can change, movement changes, a lot of things happen.
Yeah, mood changes. The thing that happens the most is that they realize that the headache was gone in an instant. So they came in with other things, and then the headache goes away. But they didn't know that physio could take care of the headaches as well. Often they come in, they're like, oh, today I was debating to come in or not because of that headache. So we do our assessments and we check what's the cause of the headache, and depending on the cause, if the cause is like what Matthew was explaining, those little joints that are stuck or they're very stiff, those muscles, we release them and instantly the headache disappears.
When we're talking about physiotherapy, there's a variety of different machines. You got the ultrasound interferentials, but are we talking maneuvering? Are we talking exercises? What kind of physiotherapy are we looking at?
It's actually a combination of both. So if we're talking about physio, then for treatment techniques, it's a matter of mobilizing the joints here or manipulating depending on the scenario, and then addressing whatever muscles that are either tight or short or weak or whatnot, and addressing it all that way. So sure, modalities like the interferential and all that can help, but in the long term, it's more about getting or restoring the function or getting rid of the dysfunction so that you're better. And the machines will help your symptoms, but it won't actually help with the cause, right? So it's the manual therapy and the exercises that actually deal with the causes.
Oftentimes, when you're talking therapy, you'll say go home. You've got ice or heat. Are ice and heat factors in this?
Yes, they are. It's a function of the person. Generally speaking, most cases, ice is the best option, but there's preferentials. I mean, people have their own preferences, and it also depends on the injury as well. But as a easy rule, if you're getting a headache and it's a tension type headache, if you put an ice pack here, after a couple of minutes, or maybe, we'll say about 15-20 minutes, you're going to notice a change in your headache.
You will.
You usually do, yeah.
Then do you want the mobility, or you let the freezing of it stay?
You want the mobility, because if you take away the freezing, then the restriction's still there, right? And then you're back to being stiff and everything gets all sore all over again.
We're going to have a couple of exercises, because while people can head into the office, there are ways that you can do some exercises, is that right? To be able to help, maybe loosen, maybe help with that? And you can do them even sitting?
Oh yeah.
Okay,
yes,
let's look at one.
So that's why, like Matthew was explaining before, those types of headaches, they come because those joints, they're very stiff. So there's a positioning of the head when the shoulders are rounded and the head is sitting forward. I think figure 2 has a good picture of that. So when the head sits forward, the lever is a little bit more. So it puts a lot of tension on these little muscles of the neck there. So as a general exercise, you can just sit straighter and try to bring your head on your shoulders, align your ears with your upper shoulder. So just a chin tuck. So a lot of people, they say, okay, I take the correct posture. They like that. They just squeeze their shoulder blades back. But it doesn't correct the posture because the head is still forward. So it's about bringing the head mostly on the shoulders, exactly.
This has to come in. Am I doing it correctly?
Yeah, it doesn't need to be too much.
Okay.
It doesn't need to be exaggerated, but just a little bit, exactly.
And you would do that repetition?
You do repetition sometimes, but as a correction of posture, you try to consciously make an effort to keep it on the shoulders.
Okay, maybe you could try that as we're heading into commercial break. As you're sitting there, maybe bring in the chin underneath just a little bit, and we will continue to bring you more information, especially for those of you who are finding your headaches can be debilitating. Please send us in your questions, 789-6559, extension 2803, if it's the number you want to call. You can always email us, ottawa.morning@ctv.ca, or send us a message as well via Facebook. We have to take a quick commercial break. We're back with more after this.